Connecticut, we age well, we age well, we all can. In Connecticut, we age well in every town across the lifespan.
Welcome to the Age Well Academy, celebrating that our communities are stronger when we all belong. The Age Well Academy is produced by the Connecticut Age Well Collaborative, a statewide, cross-sector initiative that fosters communities where we all thrive as we grow up and grow older. Learn more about aging, dementia, and disability-inclusive communities at ctagewellcollaborative.org. The Age Well Academy is an initiative of
Connecticut Community Care, providing care management and transitional support services and helping people thrive at home with active and meaningful connections to their communities.
In addition to Connecticut Community Care, the Connecticut Age Well Collaborative is also generously supported by
the Point 32 Health Foundation, working to support, advocate, and advance healthier lives for everyone.
The State Department of Aging and Disability Services, maximizing opportunities for the independence and well-being of people with disabilities and older adults in Connecticut.
Connecticut sits in an international landscape, collectively celebrating a new reality. We're living longer and healthier lives than ever before. As demographics shift in unprecedented ways, there's a new urgency and opportunity to prioritize aging, dementia, and disability inclusivity in all of our work. Today, we'll look at how that lens is being applied in Connecticut to deepen downtown vibrancy, housing choice, and clean energy. And we'll transcend international borders for inspiration and conversation toward greater collective impact. Welcome to our second event in the 2023 Age Well Academy. Hi, everyone. It's great to see you today. So glad that you're here. My name is Alyssa Norwood. Thank you for joining us for today's event. I'm the proud director of the Connecticut Age Well Collaborative, and today's event will be recorded, shared, and posted later online. So, like most of us during the pandemic, I found myself leaving the house less, and I deeply celebrate walking and riding my bike in public transit, but one of the pleasures that I've been able to integrate back into my life again is listening to podcasts when I drive. And Jonathan Faust is this beautiful heart-based being who freely offers spiritual teachings from all faith traditions. And I've had the gift of hearing his teachings live on retreat, but the next best thing is listening to him in my car. And recently he told a story about Kermit the Frog, great source of inspiration, that I'd like to adapt for all of you. So Kermit, for a long time, had been experiencing periods of total forgetfulness. He'd come to the end of a conversation, there'd be a blank, and then he'd next find himself totally somewhere else. So he decides to go to the doctor and order some tests. And the doctor goes into another room to review Kermit's x-rays, and he discovers a human hand inside of Kermit, which of course we all know to be the hand of Jim Henson and his successors. So the doctor returns to the examination room and Kermit asks, well, and the doctor replies, I know what's going on. I know why you're having these periods of forgetfulness, but this news will change your life. Are you sure you want to hear it? I love the vast teachings in that story, ranging from the invisible hands that animate so many aspects of our lives to our fear of introspection. But its relevance to this work and why I'm telling it to you now is it's really about making the unseen seen. And it's about raising, in this context, our collective consciousness on ageism and ableism, as we did together in our last Age Well Academy session, because when we see more clearly into the truth of things, when we see inside, we can see the societal glorification of youth, of able-mindedness, of our physical vigor and productivity and efficiency, And when we look more deeply, we can then start to value other things like presence and resilience and accumulated wisdom and connection and subtlety. So we can then open to our future selves and to the inevitability of our changing minds and bodies without any judgment. And it's from that place, when we see our shared humanness, that we can really start to make systems change. So in that spirit of systems change, as many of you know, the Point 32 Health Foundation is a leader in New England in fostering places that support and value people across the lifespan. So it's now my great pleasure to introduce Christina Matthews, Program Officer from the Point 32 Health Foundation, who will introduce in turn our keynote speaker. So over to you, Christina.
Thank you so much, Alyssa. Thank you for that beautiful and thoughtful illustration, also for setting the stage for us today. And thank you to the team at the Connecticut Age Well Collaborative for hosting this forum. On behalf of our board and the staff of the Point 32 Health Foundation, I also want to thank all of you for joining today's session. I'm joined today by my colleagues from the foundation, our president, Nora Moreno-Cargi, and other colleagues, Philip Gonzalez, Regina Donovan, Caitlin Sullivan, Erin Johnson, and Aubrey McNiff-Daniels. For those who are not familiar with the Point 32 Health Foundation, we were created through the combination of the Harvard Pilgrim Healthcare and Tufts Health Plan Foundations. We carry forward the legacy of these predecessors, which includes support for efforts focused on healthy aging and older adults across 5 New England states. Healthy aging is about how we take care of each other and support our future selves. It requires collaboration, creativity, and commitment. That is why today's session is so exciting. Today is an opportunity for us to connect and reflect on the healthy aging movement and each of our roles in it, and to do so in the company of an international expert with a global perspective. Connecticut is not alone in this journey. Our region is working hard to become more age-friendly. On Thursday afternoons in March, there will be webinars just like this one, hosted by the statewide Healthy Aging Coalitions in Maine, New Hampshire, and Rhode Island. We just had a similar one in Massachusetts last week. If you're interested in those sessions, please find more information on the foundation's website, point32healthfoundation.org. I also want to note that for these sessions, Dr. Kalache typically has a longer presentation, but in order to maximize interaction today, he will give some briefer remarks and engage more fully during the panel discussion and beyond. We thank you, Alyssa, and the Connecticut Age Well Collaborative for hosting this session. I would also like to thank Tim Driver, president of the Age Friendly Institute. Tim was unable to be here today due to travels, but he has been a great partner and collaborator for us in making today possible. And finally, thank you to Dr. Kalache and our Connecticut leaders for being so generous with your time and expertise. Now let me introduce the one and only Dr. Alexandre Kalache. Dr. Kalache is one of the key champions of the age-friendly movement. We are so fortunate to have him here on Zoom, dialing in from Brazil. Dr. Kalache is on the board of directors of the Age Friendly Institute. Its consumer website, agefriendly.org, invites older adults and caregivers to share reviews and ratings about programs, providers, businesses, and other services. Dr. Kalache has been a revolutionary on worldwide aging policy issues for 4 decades. He has done this as an academic and as a civil servant. He has been with the University of Oxford and London. As director of the World Health Organization's Global Program on Aging, he started the Age-Friendly Cities movement, which now includes thousands of cities around the world. Dr. Kalache, thank you so much for joining us today.
Thank you so much, Christina. It's a real pleasure to be here. I warmly thank not only the trip to Point Health Foundation, but also the Aging Well Academy, and of course the Age Friendly Foundation, of which I have the honor to be a co-director. I have been with you presentially, and I will be running this series of seminars in the 5 states. As you have explained, Christina, we will compress. My presentation last week lasted for half an hour. You have asked me today to make this introductory remarks only 5 minutes. And what I would like to say is that my experience globally, having been the director of the WHO Department of Aging and Health, is that there is no doubt whatsoever in my mind that the defining demographic forces of this century are going to be, on one hand, aging, and on the other hand, urbanization. I directed the WHO program from 1994 to 2008. We had, within this period, halfway through the World Health Assembly run by the United Nations, we presented the active aging policy framework. When I say we, WHO, we adopted a very strong life course. We are going to be in old age the result of our life experiences, events, our choices, our behavior, our lifestyles. But it is important that we have public policies that will ensure that the healthy choice is the easiest, the most accessible, and preferably the cheapest, so that we can sustain this personal effort from the individuals so that they can age well. When I was with WHO, I heard, that was around year 2000, from the United Nations Population Division, that by 2007, there would be more people living in urban areas than in rural areas. This in itself is revolutionary. It had never happened before in the history of humankind. In parallel to that, of course, people were already, and for decades, especially first in developed countries, but then globally, living longer lives, as it has already been said. So you have aging, and we have the fact that people are going to age more and more in cities, which did not seem to me to be prepared for this aging. And that was the motivation to establish a project worldwide that we could start to prepare cities where individuals are going to age. Cities, urban communities. And we started this in 2005, 2006 with a pioneer project in 35 cities around the world, that we could implement a methodology that was developed in Vancouver by WHO with many partners, the Vancouver Protocol. The Vancouver Protocol put it into operation the active aging framework. And this framework is based on 4 basic pillars: health, lifelong learning, participation, and the last pillar, protection, security, that people will need in order to age without the horror of getting older. Historically, it has always been, and will continue to be, if you age without knowing that you will be protected, that you have security, that you have the minimum. It could be a roof on top of your head, food in the shelves in the kitchen, and a little money to pay for the services. I have to say that I was deeply disturbed by a video that I saw from your country, an older woman that was expelled from the second hospital in which she was seeking health services. She was old, she had broken her ankle, she had had a stroke, but she didn't have insurance. And the police forced her into a vehicle, and she was saying that she was going to be arrested. And she was protesting. She said, "You cannot do this to me." And eventually she was forced to get into the vehicle. And there she died. That is not what we want for our societies. We want to have the certainty, the security that we're going to age with dignity, that we have the minimum basis for active aging, health, knowledge, right to participate in society, and the right to feel secure, to be protected. That was behind the motivation of launching in 2007, that is just over 15 years ago, this age-friendly WHO guide. And I do feel proud that today, what we started in a very humble way in 35 cities globally, today we have thousands of cities of all sizes, from big and very influential cities around the world to small communities, sometimes rural, sometimes the small towns, which have difficulty to access services for their population, including, of course, older people. So that is what I would like to say at this point. And just finishing with one important aspect. If it is friendly to older people, it's going to be friendly to you, a younger person. It's going to be friendly to you living with a disability. It's going to be friendly to your father, to your grandmother living with a dementia. It is going to be friendly to all of us, including, of course, you, younger today, aspiring to be an older person tomorrow.
Dr. Kalache, thank you so much. You know, when you speak about this small movement that you began at the World Health Organization more than 15 years ago now, I feel a lot of joy. I know we're in webinar mode, so our attendees can't see, but there's a long list of thought leaders in Connecticut that have been advancing this work at the local level in the state. So we have a wealth of celebrants in the room who appreciate and understand and align with the values that you're mentioning. So I'm posting, I hope that you all can see on my screen. Is my screen up? Yes, a thumbs up from someone. So we adapted that World Health Organization model that you referenced, and you know, through a very broad process, right-sized it for Connecticut. So you'll see that many of these areas are familiar. You helped pioneer them, but our theme today is collective impact. And the definition that the Connecticut Age Well Collaborative uses, you can see here, is a network of community members, organizations, and institutions who advance equity by learning together, aligning, and integrating their actions to achieve population and systems level change. And necessarily a task this large and a framework this broad requires a lot of different partners. So I'm delighted to welcome to the Connecticut Age Well Collaborative a growing list of organizations who've all made a formal commitment to work with us in creating and fostering a more aging, dementia, and disability inclusive Connecticut. And among our formal collective impact partners and as well as our informal and growing network, I'm delighted to invite 3 speakers that will be joining us before we move into the more interactive part of our presentation to briefly talk about their work. So to introduce each of them, Michelle McCabe is the Executive Director of Connecticut Main Street Center, where many of you know she brings a decade of nonprofit management experience. Her recent experience includes serving as interim executive director with Homebridge Ventures, which is a nonprofit focused on holistic workforce development and reentry programming for formerly incarcerated individuals, and director of the Feed Center with the Council of Churches of Greater Bridgeport, with whom she built multiple programs from the ground up. Christy Stewart leads the Centers for Housing Opportunities as its chief initiative officer. With over 2 decades of leadership and project management experience in collaborative initiatives, her work at the centers focuses on ensuring equitable access to housing opportunity in Fairfield and Litchfield counties. Marielle Mongo is project director for the Clean Energy Group. And in that role, Marielle manages technical assistance and capacity building programs to provide critical services to support critical service providers and community-based organizations in their efforts to develop resilient power projects that benefit marginalized communities. She also leads CEG's efforts advocating for resilient power is essential to public health and emergency response, especially for high-risk and medically vulnerable populations. So before, again, we begin our collective conversation, we asked Michelle, Christy, and Marielle to tell us about the connection to aging, dementia, and disability inclusivity in their work. And Michelle, if you would do us the honor of please getting us started. We're so glad you're here today.
Thank you so much. I am so thrilled to be here. I want to thank Alyssa for inviting me and the Connecticut Age Well Collaborative and so many partners and experts in aging well that are on this webinar. I'm going to zip through my presentation because I'm excited just to give you an idea of what Connecticut Main Street Center does as an organization, and then look forward to learning from all of you of how we can do our work better in the service of our older adults as part of a vibrant downtown community. So next slide, please. Connecticut Main Street is a nonprofit organization that's been in the state of Connecticut for about 25 years. And our role, as our name suggests, is to work with downtowns and main streets across the state, from a rural Main Street experience, suburban and urban experience. And we look at Main Streets as a holistic ecosystem that involves all kinds of components in order to be successful. And as an organization, we work with our members to bring them best practices, technical assistance, education and training programs that can help them to build out their successful Main Street according to a 4-point approach. Next slide, please. As I mentioned, our members are across the state, and they can be anything from an actual Main Street program to economic development directors and staff to volunteer commissions that are charged with overseeing a Main Street. We're a coordinating program of National Main Street America, and we advise according to 4 points that would include organization, promotion, design, and economic vitality as the core to creating that vibrant ecosystem that is going to be inclusive and successful to all that are interacting with it. Next slide, please. As Connecticut Main Street, we sort of broadened what that means to include, as you can see, 6 additional components. And really at the end of the day, a successful Main Street is inclusive. And in order to be inclusive, it means that anybody who is interacting with it as a resident, as a visitor, as a tourist, as a business owner, that their ability to shop, live, work, play is successful. And by being successful, it means that it's accessible. This opportunity to introduce ourselves to you and your audience allows us to really broaden our thinking about what our role can be to shepherd our main streets and downtowns in looking at what they do and questioning whether or not it's an age-friendly place. Next slide, please. In preparation for this webinar, I started doing a little self-education on my own, and I know that I am going to most likely be preaching to the choir, so to speak, among folks that know a lot more about the topic than I do, which is why I'm so excited to be here and to learn from you. But we know that older adults, more than ever, much like a lot of people, young people, working people, are looking to live in downtowns and main streets, looking to live in walkable communities that are easy to get around and have a great public transit system, and where they can get everything they need right where they live. Next slide, please. There are obviously a lot of benefits just to being in a community where you can walk around to get to what you need to do. Aside from the health benefits, obviously, of being able to move around, there's also the mental health benefits of living in a community where you are actually integrated into that community and can interact with your neighbors and feel like you're a part of the larger world. Next slide, please. And so a lot of developers are actually starting to sort of catch on to the fact that we have this wonderful group of residents that they should be designing buildings for. Some of the most interesting studies that I found were around the intergenerational living arrangements, where you are offsetting some of the high cost of living in a downtown or a main street by creating communities where young and older renters are together in a single development. And it's great to see that this is a focus, not only for both the older adults and the young people that we are looking to bring into our Main Street environments, but also we have to take into account the caregivers as well, and making sure that there's an opportunity for affordable housing in these neighborhoods. Next slide, please. So as Connecticut Main Street, we're really eager to participate in this conversation and to learn more about how we can begin to gauge our main streets and downtowns and learn whether or not they are in fact engaging in age-friendly practices, and ways that we can help them to become even more age-friendly when they are looking at their main streets. So we've developed an assessment tool, many of the questions of which do hit on some of those important key topics that would assess whether or not a community is age-friendly, but we're looking forward to being able to potentially broaden that to be more specific to older adults. So I thank you so much for the opportunity for a brief introduction. I'm really excited to learn from everybody and to have an engaged conversation afterwards.
Thank you so much. I'm so delighted. What a wonderful start, Michelle. Thank you. And it's now my great pleasure to introduce Christy. Christy, thank you so much.
Thank you, Alyssa. Much like Michelle, I echo her thanks for the invitation to be with you all today. I am Christy Stewart. I work for an organization called the Housing Collective. We are a collective impact facilitator. I run our affordable housing practice, which is called the Centers for Housing Opportunity. And we are particularly focused on making sure that there is equitable access to safe and affordable housing in every community in which we work. Next slide, please. Thanks. So just a few seconds on the Housing Collective. We work in the service of systems change. We have been in existence since 2008. We have two key initiatives around housing. One, we focus on homelessness and the homeless response system. And then, as I mentioned, where my work lies is in the affordable housing space. So I'm excited to be here today to draw the lines for you, to connect the dots between aging and the affordable landscape, housing landscape in Connecticut. Next slide, please. Great. So one of the most important resources that we feel we bring to the state is data. The Housing Collective and the Centers for Housing Opportunity are particularly focused on using data to push informed policy and to hold our elected officials, policymakers, and practitioners accountable for both recognizing need and making progress to meet that need. We partner with all kinds of data partners on the national level, including Urban Institute, and then all the way down the line at a local level in Connecticut with organizations like Data Haven. And so while we do not consider ourselves researchers, we manage project teams that pull really important research together to inform decisions around housing policy. Next slide, please. Great. So the key data points, and I promise I do have a point in all of this that I want to draw to your attention today, is that our data has shown that right now there are over 86,000 more very low income households in our state than there are units of housing affordable to those households. This has all kinds of impacts for those families. But what's important to understand is that there isn't a county in Connecticut that has enough affordable housing units to meet the needs of its very low income residents. And when I say very low income, we're talking between 0 and 30% area median income, which in Connecticut can be as low as $19,880 a year for a household. And as much as $52,760 if it's a household that includes 8 people. So just a little bit of context. Next slide, please. And here's what gets interesting from an aging perspective. Of those extremely low income renter households, where we know we're 86,000 units short, over 50% of those households are seniors and or people with disabilities who need housing that is accessible. And that is not a statistic that you see used often in the housing space. And we think it's critically important as we consider policy changes that will hopefully move the state in the direction of better meeting the needs of an aging population. Next slide, please. So great, not a surprise that there is also a relationship between affordability and accessibility needs. And generally, a larger share of low and very low income households report having at least one member with a disability. And roughly a third of assisted housing, which in this context means subsidized housing in Connecticut, needs to be designed for residents who have a disability, especially those with physical, ambulatory, and cognitive disabilities. Next slide, please. And this is just taking a look at population trends. If you look at the blue bars, we're looking at through 2030 and the gold bars through 2040. And you can see the population trends in our state. We're getting, there'll be 44,000 more households in the state by 2040 that have mobility or sensory needs. Next slide, please. So just some key trends, I think, if you were going to take nothing else away, it's that we have this gap of 86,000 units of affordable housing for those that are very low income. I'm not going to read the rest of those, so I'm going to keep moving. The next slide, please. 1/3 of all of that housing needs to be, of all subsidized housing in the state going forward, is going to need to be accessible to those with disabilities. Next slide, please. So by committing to a data-driven, proactive investment and policy approach, we think that the state of Connecticut should target populations in each county where the need for housing at designated cost bands and accessibility levels is greatest, and prioritize its investment accordingly. Obviously, we have some thoughts about how to do that, but what we think that our research has most powerfully uncovered is that connection. Just the idea that of all the housing we build going forward in Connecticut that is affordable, 30% of it at a minimum also needs to be accessible housing. Next slide, please. Thanks. And I will leave it there. I'm really excited for this conversation because if you look at the last bullet, we believe that meeting this challenge is going to require the alignment of a broad coalition of advocates and partners. And that is exactly who Alyssa has brought to the table for this convening. And these are really important conversations, these cross-sector conversations that we're all beginning to have. So thank you very much.
Christy, thank you so much. This isn't my first time that I've had the privilege to engage with this data, in part because you have many different valued roles in the collaborative's work, including that we didn't mention earlier, you serve on our steering committee, but it's powerful every time to understand the depth of the need and putting it together with Michelle's remarks to make sure that this development happens thoughtfully and not necessarily where it's easiest to develop or the land is least expensive, but where it's most needed and people can really live connected lives. So thank you both. And it's a beautiful segue into the last of our 3 formal presentations before we have a larger conversation. So Marielle, take it away.
Hi, everyone. I'm Marielle Mango. I'm a project director with Clean Energy Group. Briefly, Clean Energy Group is a national 501c3 organization that works to progress clean energy, and especially in underserved and marginalized communities. We do that through policy, program development, project support, coalition building, and I encourage you to check out the website if you'd like to learn more. Next slide, please. What I'm going to be focusing on is our efforts to connect health equity and energy security, especially as it pertains to medically vulnerable electricity dependent residents, a large portion of which are folks over the age of 65. At least 2.5 million people rely on electricity dependent medical equipment across the country. Millions more use electricity for home care services. Extreme heat is, we're increasingly seeing air conditioning being considered a part of a medical plan because extreme heat ranks #1 for weather-related deaths. A vast proportion of those, which are folks over the age of 65, and especially for those over the age of 80. And what we've seen is that, rightfully so, as policies in this country have shifted to encourage folks to age in place and be able to stay home as they get older, which is fantastic, they haven't had the same preparedness as you do if, say, you're in a nursing home or in a hospital or in a supportive care facility, where typically there's more robust emergency preparedness. Oftentimes there's some sort of backup power. In these cases, especially for folks that rely on home medical equipment, there's just no, in the event of a power outage, unless you have an external battery, there's really nowhere to go from there in terms of energy. Next slide, please. So this is where we come in. We advocate for resilient power, which is solar PV paired with battery storage, to provide reliable backup power in the event of a power outage. Solar and battery storage have economic benefits during regular grid operations, and it does not come with the climate, air quality, and reliability issues that are associated with traditional diesel generators. Next slide, please. And what we're focusing on today is our partnership with Connecticut Green Bank. We are working with Connecticut Green Bank to help promote the energy storage solutions program they have, which is an awesome incentive opportunity, especially for affordable housing providers interested in battery storage. And what we're doing at Clean Energy Group is helping affordable housing providers in Connecticut, especially those that work with electricity dependent or medically vulnerable populations like senior housing or supportive housing, to understand what would resilient power look like for my facility. We're collaborating with Connecticut Green Bank, Operation Fuel, Yale University, really trying to make this a robust effort to not only understand what are the needs of electricity dependent residents living in affordable housing, but what's the best way resilience can support them in the event of a power outage. Oftentimes we work with affordable housing developers to equip a community space in the building with resilient power so folks can charge their electricity dependent medical equipment in the event of an outage, or access a fridge for perishables and temperature regulated medication. The space is also heated and cooled. These are big deal, minimal investment upgrades that can actually support folks to shelter in place through a couple-hour power outage versus seeing an emergency response and having to go to the hospital simply to charge a medical device. So CEG is kind of the one-stop shop for that. We're providing small grant support to these organizations, as well as hand-holding and connecting to engineers to actually conduct a solar and storage feasibility assessment for your property with a health focus. So this is what solar and storage looks like. Here are the economic benefits. Here's what it would cost. And here's what it would support. What does resilience look like for you and your residents? And through our partnership with Connecticut Green Bank, we can really dive deep into what are the incentives. Connecticut Green Bank has really awesome financing opportunities that folks can learn more about, and really just provide that one-on-one hand-holding support, because I can't tell you the number of folks who I talk to who say, I'm interested in solar and battery storage, but I don't know how to get my foot in the door. We don't have the capacity. So we're really here to help with that and make sure that there's no out-of-pocket expenses to learn how solar and storage can be beneficial for your facility, and to ensure that it's being supported like an institute like Connecticut Green Bank that offers kind of these awesome incentive programs that can just get overlooked. And that's all in addition to the federal incentives that have been increased this past year to be able to offer 30, 50, 60, 70% of project costs covered in direct pay to nonprofit organizations. So I know I only have 5 minutes, it's a lot of information, but I encourage anyone who is interested in solar and battery storage to reach out to Clean Energy Group. I think on the next slide is my contact information. To learn more, because we have the funding and the capacity and the support to be able to provide affordable housing providers in Connecticut with that support. So thank you very much.
Marielle, thank you so much. And we'll distribute slides after the presentation. I know you included an appendix slide that we won't have time to discuss right now with a case study of the tremendous work that you do. So I'm gonna invite all of our panelists to turn on their cameras, and we're gonna have a little bit of conversation. And so I went to New Orleans. I had the privilege of being able to go there a few years ago, and I walked around, and when I came back, people asked me, what excited you when you were there? And I'm an attorney by training, and I rounded the corner and I came upon the Fifth Circuit, and I was so excited. So maybe this says something about, my personality, but I kind of feel the same now, right? I'm with all of these superstars. Thank you for being here. I'm really starstruck. And Dr. Kalache, you have this amazing history and international perspective. And as you sit and listen to this panel, in 15 years ago, were conversations like this happening about aging, where representatives from clean energy and housing and downtowns, and how have we journeyed? Kind of what's the retrospective, and where are we going in terms of creating a really broad tent?
Answer. The first thing that I would say in the introductory remarks, I think that you said that we are going to bring together people that are not traditional partners on an age-friendly environment. And I should say that every single aspect, every single sector of society has something to contribute in order to make an environment more age-friendly. And you have illustrated that. You have illustrated beautifully, Michelle, bringing the experience of Main Street centers, Christy, with a very interesting presentation about housing, and then the energy that we heard from Maria. Let me just bring some of the points that have called my attention in particular. And I will start reversing. You have been to New Orleans. You have been the privilege to be in that exciting city. Do you remember what happened there a few years ago? The devastation, a devastation that should not have happened. You cannot control natural disasters. But when we say natural disasters, it sounds like fatality, that there is nothing that we can do to minimize the impact on human lives. There is always something that can be done to prevent the devastation to happen in the first place. I'm talking to you very aware that last week, along the coast here, very close to Rio, only about 200 kilometers away, we are in the peak of the summer, we have floods. We know we have floods, and there will be more climate disasters today than before because of climate changes, because of the way we deal with the environment. And dozens and dozens of people died because they had precarious housing in places where there should be no housing at all. Only 3-4 kilometers away, the rich people were perhaps annoyed because it was raining a little too much and they could not go to the beach. But the people that provide services to them live in on the hills where we know it is risky, lost their houses, lost their lives, lost their loved ones, because there isn't a proper housing policy that will afford, in a rich country like Brazil, like the United States. I have to say that I also have the privilege to have been traveling throughout the world. I have been to New Orleans, but I also have been to San Francisco, and I was absolutely shocked by the number of homeless people wandering, many of them obviously with mental health problems, in the heart of one of the richest cities in North America. This is unacceptable. And this is to do with inequity. And this is what I was pointing out to that old lady that was forced into a police vehicle to be taken, arrested, because she was demanding health services, and she died inside that vehicle. We are talking about inequity. You have started this rich conversation talking about inclusiveness. We have to put this word right at the center of policy. We have to make resilience at the individual level, but also at community level, as the main goal to build the resilience, which means building reserves. As we get older, we know that we need to be resilient, and we need to build these reserves in order to reach old age. But for some, old age comes at 85, 90. For others, because they are poor, they have lived a life of being excluded, being abused, without access to services, and they age much earlier. We have seen this in the pandemic. In your country, like in mine, Black populations died 3, 4, 5 times more than the white population. Those live in the periphery. You may not have the favelas that we have in Rio, the favelas that we have in Brazil. You know what a favela is, a slum area with housing that is a demonstration of lives without any dignity, that you cannot talk about inclusiveness. But Michelle has called attention to something that is so critical: best practices, research, monitoring. We need to ensure that our interventions are based on evidence-based interventions. We need to monitor, we need to measure the impact of our policies. And that is what I compliment Main Street Center for doing this. And you have existed for 25 years. That is also to remind us that when you started, maybe with people that would be running in their 30s, and now they're old. We have to bring this idea that old age is not out there, has nothing to do with us. We are all aging. We are all in the same boat. And the initiatives and the institutions themselves, they age. And we have to bring this dynamic cycle to remind you today, as I look at the panel and I see these intelligent, talented women that are probably in around the age of 30, that by 2050, you are going to be 60 plus. And in 2050, the world will have aged irreversibly. In my country, for instance, we have today 15% of the population aged 60 plus. In 2050, it's only 27 years from now. It's going to be 31%. We are going to double the proportion of older people. And let me remind you one thing that is important when we are talking about inclusiveness and inequity. The United States is not aging as rapidly as Brazil is because you are able to bring immigrants. Immigrants that will rejuvenate your population. You need them because you are aging. And you replace this lack of people that are in their 20s and 30s attracting immigrants. And also they bring with them higher fertility rates. They will produce more children that in turn will rejuvenate the population. And this is why the United States, contrary to the trend throughout the world, are going to continue to be relatively younger in age structure than, for instance, Canada next door or the whole of the European continent. Welcome them. Welcome them because you need them, because there is aging and you are lucky enough to attract younger people. But treat them well, with equity, with inclusiveness, because these are the people that are going to provide care to your older people. And maybe they are going to provide care to you as you age. I lived in Denmark, in Switzerland, in France, in Spain, in the United Kingdom. I lived in New York for 2 years, in Australia, in New Zealand, in a range of developed countries. And in all those countries, the people that provide care are the brown and black faces that so often suffer from prejudice, are excluded. Racism is prevailing. We have to be aware that in a world that is aging, this is important also to bring the concept and the policies that will make aging well an experience, not for the well-off. I don't want age-friendly cities for cities that are already rich and interventions that will make relatively little impact. I want to bring age-friendly policies to the slum areas that will protect the poorest of the poor. And you talked about downtowns that are affordable, that are accessible. I have a dear friend, Claire, who lives in Chelsea, in New York, one of the wealthiest districts in Manhattan. She lives in the 4th floor. You talk a lot about aging in place. Claire is living a miserable life because she is living an aging in place. There is no elevator. She has disabilities. She's trapped in her apartment. And she's constantly threatened by the owner of that apartment because he knows that if she dies or moves away, if life becomes impossible for her to continue to live there, he is going to attract a much higher rental. She is unable to make the necessary adaptability to her bathroom. He doesn't want the owner for her to change the bathtub so that she has a shower cubicle that she can more easily shower herself. It's a barrier, a physical barrier, and she cannot change because she is in a social capped kind of rental. And therefore, she knows that anything that she would do without his approval, and she is going to be expelled. That is what I'm talking about, for affordability, accessibility for all. You have given us the example that there is problems with accessibility for the poor. 38% of them living with physical disabilities, as opposed to less than half if you are in the higher socioeconomic group. And this group, they can somehow overcome the problems by making adaptations to their housing. They are not, like Claire, prevented to do so. So we have to think about equality, inclusiveness the whole time.
Dr. Kalache, there's so much richness in what you said. I wish we had a whole another hour, but I do know we're coming too quickly to the end of our time. So I wanna end. There's so much inspiration in this space, and I want to ask you and each of our panelists, what's one project, policy, initiative, something that you've witnessed in your work related to creating more aging, dementia, and disability inclusive spaces that inspires you or that excites you? So I don't want to put any one person on the spot, but Christy, I'm going to ask if you'd be willing to go first.
I will try. And that's such a lovely question. And I wonder if I wouldn't have answered it differently at 8:30 this morning, that I did to get halfway through your workday. I become a little more cynical as all my meetings go on. I think just the fact that the Department of Housing in the state of Connecticut was interested in researching and understanding what the connection is and, you know, the nexus is between affordable housing and accessible housing, so that they can get a handle on what they need to do. Just the fact that they were willing to look at that data and think about it is definitely a step in the right direction. I, of course, would like them to take, 20 large steps in that direction, but we'll take what we can get, I guess, for now.
Thank you, Christy. Michelle, what about you?
Oh, well, I would say that collective impact is the best impact. And, when we talk about inclusivity, it's not just sort of the end user, but it's also all of us as well. And that, Main Street involves all sectors all the time. So we're used to thinking about our work in terms of an ecosystem and bringing different stakeholders around a table to ensure that this particular plot of land is inclusive and accessible. And so for me, just being invited is really exciting for me at the table, being introduced to people and looking at ways that we can leverage our tools to be able to provide some of those benchmarks, to be able to apply some of those best practices, to be able to engage all the people that are involved in Main Streets, from planning and zoning and economic development to store owners, to property owners, to the folks that make sidewalks and crosswalks and, wayfinding signage and all of that, to be able to partner with everybody here to be able to think about our Main Streets and downtowns specifically in an age-friendly way. So I would say that.
Marielle.
I'd have to go with, solar and storage, especially battery storage, remains, even though prices are going down, it is still an expensive technology. So to see different states start to adopt incentive programs like the way Connecticut's doing, in addition to the federal programs, recognizing that low-income communities, underserved communities, critical service providers need additional financial support to make this happen, to actually serve the most vulnerable populations like seniors and folks with electricity-dependent medical equipment, has been really inspiring, in addition to just the on-the-ground activism and one-on-one community work that goes into ensuring that folks in marginalized communities have access to clean energy technologies and community ownership that are really benefiting the folks that need it the most, whether that's at a senior center or a food pantry or an institution of faith. So being able to see those two things, the community advocacy, as well as states like Connecticut and New York and California start to adopt policies that actually support solar and storage adoption for the most vulnerable communities, has been fulfilling, after not really seeing that so much for the past 10 years prior.
Thank you, Marielle. Dr. Galacha, I'm going to call on you to answer as well, but I'm also going to name that it's 2:30, that we advertise the webinar to be an hour. So those who have a hard stop, we want to honor your commitments and we thank you for being here. For those who were able to stay on, we're going to run 10 additional minutes. So we hope and invite that you'll stay for those 10 extra minutes. So Dr. Galacha, there are so many ways to answer the question that I've heard you answer, whether you've known or not in other talks. I'm curious today, what inspires you?
What inspires me are things that I have seen in Canada. And I related to the last presentation from Marielle. I think that we are going to experience more heat waves. We are going to experience more cold fronts. More older people are going to die as a consequence. And I think that we have to think about how we can control the devastation that the environment can create. I have seen in 2003, I was living in France, 40,000 older people dying because it was a bit too hot. We have to control the environment. And that is by creating policies that I have seen in practice in Canada, including very small communities, communities that are very far away from services. And if we don't do that, we are going to suffer, and we are going to create a world that, instead of being more age, disability, and dementia friendly, are going to be punitive to people that dare to age, especially with disabilities.
Dr. Kalache, I thank you. I thank all of our panelists for being here. And I'm just going to conclude with a few slides on what comes next in Connecticut. And I hope you're excited, inspired, and that this is the first of many broad-based conversations that we have where we draw connections across different disciplines to create a better world for all of us. So just give me a moment to share my screen. So with respect to what's next, many of you know, in the spirit of inspiration and celebration, our next Age Well collaborative event will be in person. We're going to be honoring community excellence and awarding our first annual Wellspring Awards, celebrating innovation in Connecticut communities fostering aging, dementia, and disability inclusivity. We're proudly partnering with Connecticut's Legislative Commission on Women, Children, Seniors, Equity, and Opportunity at the state capitol, both for this celebration and for the release of our resource guide, the next in our series, which is going to be spotlighting best practices and community excellence. To that end, in previous Age Well Academy events, we've had really thoughtful and amazing discourse that's been coincident and simultaneous with the release of 2 resource guides that we already have out, up, and available on our website. And I'm very excited because as the year progresses, all of our speakers touched on the importance of data. So in June, we'll be releasing a resource guide about the importance of community data and how to create more thoughtful and inclusive communities using what we know, followed by a presentation in the fall about creating community authority and the importance. The word equity has been perhaps used more today than any other word that I've heard. And, you know, one thing that we didn't have time to talk about is the intersectionality with other identities. So all the things in life that are hard that we've spoken about, being poor, being historically disempowered, you know, being disconnected, being lonely, all of these identities, there's this cumulative impact over time as we travel in through life and our bodies and our minds change. So there's a real opportunity that we have to engage not just in policy making, but at this deeper level, some real collective healing. So we hope you'll stay with us through the year and that you'll also look back at the resources that we've already produced. And I just want to bring us to a close by thanking you all for joining us today. We spent really inspired time together learning about the incredible work happening in Connecticut, both historically within traditional aging services, but beyond across Connecticut and across the world. We began with a parable about the importance of introspection. And as a reminder here from Carl Jung, who looks outside dreams and who looks inside awakes. So through this work together, may we both dream and awaken. And in that spirit, many of you know that we commissioned the incredibly talented Connecticut composer, musician, and storyteller, Jeff McQuillan, to help compose and perform our musical theme, We Age Well, which premiered last month with the launch of our Age Well Academy. It's melody, instrumentation, and lyrics, if you've all heard it, seek to capture the spirit of celebration and vibrancy that we're working to inspire in communities across Connecticut. You can download the lyrics from the Age Well Academy section of our website. And in addition to right now, you can listen later to it on our YouTube channel. Together, we can all age well. And thank you all so much for being here today.
Connecticut, we age well, we age well, we all can. In Connecticut, we age well in every town across the lifespan. We all gather wisdom in our open hearts, growing stronger when we all belong. Opportunity in community, including everyone, is where it starts. In Connecticut, we age well, we age well, we all can. In Connecticut, we age well in every town across the lifespan. Got complete streets we can get around, housing choice and public space abound. Join our progress toward equity, deep connection, and inclusivity. Visioning the future, we listen and we learn. Let's go where we grow all life long. When we feel seen, you know we're shining bright. When we honor choice, we know we're living right. Follow all to chart systems change, to make places we can thrive. We'll plan and zone together, dance here every season is good. It's so good, good to be alive. In Connecticut, we age well, we age well, we all can. In Connecticut, we age well in every town across the lifespan. In Connecticut, we age well, we age well, we all can. In Connecticut,